Hello everyone and welcome to today's lesson. In this lesson, we are going to discuss about a very important area of abnormal psychology, the cluster B personality disorders, which are often described as erratic, dramatic and emotional. You might have come across people who act impulsively, who struggle to regulate emotions, or who constantly crave attention. Some may seem manipulative, others excessively self-centered, while some people shows little regard for others' rights and for their rules. These kinds of behaviors or behavioral patterns grouped together into the cluster B personality disorders. By the end of this session, you will understand why they are grouped under this category, what their main features are, how psychologists diagnose them, and what treatment approaches are available. Let us start the session with why this cluster B personality called to be dramatic, erratic and emotional. So let us begin with the question, the basic question, why are these disorders placed in cluster B? The American Psychiatric Association classifies personality disorders into 3 clusters in DSM-5. Cluster A is odd and eccentric, cluster B is dramatic and erratic, cluster C is anxious and fearful. Cluster B is unique because the individuals with these disorders often display intense emotions, unstable relationships, impulsivity and behaviors others may find unpredictable or disruptive. Imagine living with someone who in one moment deeply admires you and in the next moment devaluates you completely, or someone who constantly craves admiration but shows little empathy for others, or maybe someone who lies, cheats and manipulates without any guilt. So the common thread here is drama, unpredictability and emotional intensity, which is why psychologists describe this group as dramatic, erratic or emotional. Let's start with borderline personality disorder. Often this shortened as BPD. So this is perhaps one of the most widely discussed disorder in cluster B. People with borderline personality disorder often experience extreme emotional instability. Their feelings can shift rapidly, sometimes within hours. So they might feel very close to someone, almost idealizing them, and suddenly switch to anger, hatred, if they feel rejected or abandoned. This instability extends not only to emotions but also to their self or sense of self. So they may feel empty, lost or unsure about what they really are. For example, imagine a young adult who feels abandoned when a friend cancels a dinner. That small event might trigger intense anger, self-harm or even suicidal thoughts. It seems irrational to outsiders. But for the person with borderline personality disorder, the fear of abandonment is overwhelming. In terms of diagnosis, if we see, the clinicians look for patterns of unstable relationships, impulsivity in areas like spending or substance use, self-harm behaviors and chronic feelings of emptiness. When it comes to treatment, the most evidence-based approach is dialectical behavior therapy, DBT. So, which helps people learn skills to regulate their emotions, tolerate distress, and build healthier relationships. Sometimes medications like antidepressants or mood stabilizers may be prescribed, but therapy is mainstay. The second disorder is about narcissistic personality disorder. So, the narcissistic personality disorder is known as NPD. This disorder is characterized by grandiose sense of self-importance, a constant need for admiration, and lack of empathy. People with narcissistic personality disorder often believe they are special or superior, and they may exaggerate their achievements, their success. However, beneath this exterior, they often have very fragile self-esteem. So, though they overestimate themselves or over-exaggerate their achievements, or they talk a lot about their own self, sometimes they even need that, thinks that they don't have the confidence, or their self-esteem will be very sensitive. So, under this, if we see narcissistic personality disorder, if we see an example, think about a manager who constantly brags about being the smartest in the company, demands recognition, but reacts angrily even for this mild criticism. So, this combination of arrogance and sensitivity is typical for narcissism. So, here to diagnose this, psychiatrists or psychologists, they look for the certain personality traits like fantasies of unlimited success, preoccupation with power of beauty or power, exploitative relationships, envy or arrogance. If we see the treatment for this narcissistic personality disorder, it's quite challenging because people with this NPD often do not see their behavior as problem. Psychotherapy, especially the approaches that focus on building that self-awareness and healthier self-esteem, can be useful to treat this personality disorder. Here, the goal is not to take away their self-confidence, but we can say through these therapeutical approaches, we can strengthen or we can develop empathy and reduce their hypersensitivity to criticism, because they do suffer with this criticism. They cannot take that criticism. They always think about their superpower. They think they are supernatural, they do have supernatural powers, or they are the heroes. So, it's quite difficult because they don't accept the reality. It's quite difficult to treat these people, diagnose and treat. And the major issue with narcissistic personality disorder, what we can find in treatment procedure is because of their lack of awareness, lack of insight about what they are going through, they might not attend the sessions. So, first we need to build the trust, develop that trust and connection with the patient, then only we can use various therapeutic procedures like CBT or DBT can be applied. So, psychotherapy is most widely accepted therapeutic procedure to treat narcissistic personality disorder. Now, let us talk about histrionic personality disorder. So, individuals with histrionic personality disorder often described as attention seeking and overly emotional. They feel uncomfortable when they are not the center of attention, and they may use dramatic expressions, flashy dressing or exaggerated emotions to keep people's focus on them. Imagine a person who enters a party and make sure all eyes on them. Loud laughter, flirtatious behavior, or dramatic storytelling. The relationship seems shallow. As they focus more on attention on genuine connection. For diagnosis, here we can say psychologists look for patterns, behavioral patterns such as discomfort when they are not on spotlight, when people are not paying attention towards their dramatic behavior, or rapidly shifting emotions, excessive concern for physical appearance, and tendency to consider relationships more intimate than they are. The treatment procedure typically involves again the psychotherapy, which helps individuals recognize why they need constant approval and teaching them to develop more stable, meaningful relationships. Unlike borderline personality disorder, histrionic disorder is less likely to involve self-harm, but it still creates significant difficulties in relationships. So, their excessive attention-seeking behavior can lead to various psychological disturbances that can affect their interpersonal relationships. So, the treatment focuses on how to strengthen their interpersonal relationships as well as how to develop that insight about their own physical personality. Then, finally, we can talk about antisocial personality disorder. This is the again most famous or well-known personality disorder in cluster B disorders. So, this disorder is marked by a disregard for the rights of others, violation of social norms and lack of remorse. People with antisocial personality disorders may most of the times they lie, they manipulate, they cheat and develop some kind of criminal behavior. And even these people engage in various crimes and criminal behaviors and often seem charming at first, but are irresponsible and impulsive in nature. They cannot control their own behavior. A classic example would be someone who scams people's money without any guilt or repeatedly breaks the law without concern for consequences. Importantly, we can say that the diagnosis cannot be made in children. There must be evidence of conduct disorder before age 15 and the individual must be at the age of 18 for diagnosis. So, the criteria, diagnostic criteria according to DSM-5, which includes deceitfulness, impulsivity, irritability, aggressiveness and reckless regard for safety and irresponsibility and lack of remorse. So, they may drive very rashly, they might not think about others, they might steal or lie or they just don't care about others' rights or they don't even empathize with others. So, these are the major characteristics or behavioral symptoms we can observe in antisocial personality disorder people. So, the treatment we can see this is extremely challenging because this antisocial personality disorder, people with antisocial personality disorder often do not seek help voluntarily. So, always there should be a person, maybe a family member or a friend or a peer group who have to take this person for professional help, because they don't even have that insight that they are lying, they are cheating with others, they are not concerned for others. So, the therapy may be focused on increasing responsibility, managing their aggression levels and reducing harmful behaviors. and in some cases medications for aggression or impulsivity are prescribed. Yes, but the overall progression tends to be poor compared to other personality disorders. If we have to summarize this, the cluster B personality disorders, the borderline personality disorder, narcissistic personality disorder, antisocial personality disorder are all share the traits of emotional intensity, drama, unpredictability and difficulty in relationships. They may look very different on the surface. One person may seem desperate for love, another hungry for admiration. There are people who might be exploitative in nature, but what unites them is the dramatic, erratic and emotional behaviors which relate the world and to one another. The treatment for all these disorders is very challenging, but we cannot say it is impossible. With therapeutic techniques or the therapies like DBT, dialectical behavioral therapy, or cognitive behavioral therapy, and long-term psychodynamic approaches are helpful for individuals to cope with this behavioral patterns. The healthier coping through these therapeutical techniques, they can develop or learn the healthier coping strategies or coping mechanisms which can give them a more stable self-images and more genuine ways of connecting with others. Because of these disorders, mostly their interpersonal relationships get affected. So, to overcome that, these therapeutic methods are helpful for individuals to strengthen their interpersonal relationships as well as to maintain or regulate their self-image. So, understanding these disorders is not about labeling or judging these individuals. Yes, we cannot name them or call them, but identifying or understanding these behavioral patterns will be helpful for them to for the individuals who are suffering or undergoing with these psychological disorders, or the psychologist or psychiatrist. It is helpful for them to connect the relation or to develop the appropriate treatment procedures or treatment strategies. So, if we generally observe 1.7% of population is undergoing with this personality disorders. There are various causes, maybe biological or psychological or social causes are responsible for this disorders. Quickly we revise about the disorders what we have discussed under the category of cluster B. So, cluster B, as we have already discussed, it is erratic, emotional and dramatic in nature. So, the behavioral characteristics what we have discussed under these four categories of disorders are mainly dependent on these three behavioral patterns. So, mostly people shows this or exhibits the dramatic behaviors or emotional instability, they crave for attention and they do manipulate, they do cheat, and all these disorders, most of the time outsiders might think that these people wantedly doing. Yes, these people, the people who are undergoing with disorders or showing this behavioral patterns, people might be misunderstand or misjudge that wantedly these people are doing or exhibiting these behaviors. But the disorders which are whatever the behavioral patterns people who are undergoing with disorders are showing knowingly, sometimes they might have insight and in some cases they might not have any insight about their behavioral patterns. So, it is quite important for all of us to understand what these people are going through. So, if we see this bipolar disorder, borderline personality disorder, where the extreme emotional shifts we can observe. Some moment, at some point of time, the person might be admires you, the person might accepts, yes, even the person might try to idealizes you, but at the very next moment, the person started the person might start hating, the person might show some angry towards you. So, this rapid emotional shift from positive to negative, from accepting to unaccepting. So, these are the major characteristics of this borderline personality disorder. So, these emotional shifts in an individual might be triggering their aggression, irritability, and they might not strengthen or maintain the good relationships with others because of this shifts in their emotional aspects, instability in their emotions. Then antisocial personality disorders. This antisocial personality disorder characteristics are mostly people won't be having any insight about their behavioral patterns, like these people might cheat, these people might develop many criminal behaviors, these people might lie. This is a compulsive behavior, there is a compulsive lying. People might not understand what exactly they are doing and how they are impacting the lives of others. So, their compulsive lying or cheating behavior most of the times might be misunderstood, or this can violate the rules or others' rights most of the times. So, they do not concern about societal norms or people's opinion, and they might lack empathy, they might not understand from others' perspective. So, these are the major characteristics which we have already discussed about antisocial personality disorder. Then when it comes to narcissistic personality disorder, narcissists mostly have they exaggerate about their achievements. They do talk a lot about their own achievements. They think that they strongly believe that they are superior, they are special. So, everyone should treat them in the same manner. These exaggerating of their achievements or their success and everything can be a problem for others. They might not give any kind of recognition for others' work. They might not understand what other people are doing, and they might not recognize their contribution for the work. For example, if two people are working on a same project, two are contributing equally for the project, narcissistic might exaggerate their work in the completion of that project. They might completely ignore the work provided or given by the other person. So, this over exaggeration or their self importance might be causing a problem for their interpersonal relationships. So, even these people are not empathetic towards others. So, they do not understand from others' perspective. They always wants praise and recognition. And as already we discussed, their self-esteem is very fragile in nature. They are very sensitive. Outwardly, they might be exaggerating or overemphasizing on their achievements, but internally, they might be having very limited or fragile self-esteem. So, the next disorder, what we have already discussed, is about histrionic personality disorder. So, this is mostly about attention seeking behavior. So, the people who ever undergo with this disorder or the problem, the behavioral patterns what they show is a continuous, they do expect the attention, they grab attention or crave for attention. So, they want to be the center of attention in every party, in every social gathering. So, this might be a causing problem for others. So, to gain that attention, they do use this dramatic expressions. They do use their fancy dressing or exaggerated emotions. they do laugh loudly, or they do create some drama in the gathering to gain that attention. This attention seeking behavior can shallow the interpersonal relationships. Yes, they might not trust others, or they cannot maintain the good relationships because they cannot give any importance to others. They only want all kind of attention from everyone. So whoever is paying attention to them, they get attracted towards them. So that's the reason these people cannot maintain a sustained relationships, trustworthy relationships. So this rapid shift of their attention, or the expectation of that spotlight attention, and the craving for their craving for others' attention, and the tendency to consider the relationships more intimate. Yes, whatever the relationship they experiencing, because somebody is giving attention, they think or feel it is intimate, but that might not be the true in all the cases. So all these 4 disorders, borderline personality disorder, narcissistic personality disorder, antisocial personality disorder, so these cluster B personality disorders are required proper diagnosis as well as the treatment procedure. So diagnosis is based on DSM-5 diagnosis procedure we are following, which is given by American Psychiatric Association. So based on DSM-5 criteria, we do diagnose, and various tools like questionnaires or probing methods are applied, and observation of these behavioral patterns based on the diagnosis procedure will be taken care. After the diagnosis, a proper treatment procedures were developed. So these therapeutic treatment procedures are nothing but the various therapeutic procedures which can be applied, depends on the intensity of the problem. So these therapeutic methods are cognitive behavioral therapy, dialectical behavioral therapy, and psychoanalysis. So in psychoanalysis, mostly we do observe the childhood traumas. Maybe the person might be undergoing with any childhood trauma, or any unexpected undergo with some events or something. So that childhood trauma might be triggering for this adult behavior. So psychotherapy can be used to understand this childhood traumas and conflicts and defense mechanisms. Dialectical behavioral therapy and cognitive behavioral therapy are widely used to understand the irrational belief system of an individual. So mostly these therapeutic methods are helpful, these therapeutic techniques are helpful for an individual to develop good empathy towards others and maintain a healthier relationships, as well as to maintain a self-worth. So understanding about the behavioral patterns, diagnosis and treatment, these 3 together helpful to know about this cluster B personality disorders. So we cannot ignore if we are consistently seeing a dramatic or emotional or erratic behavior of an individual. Thank you. I hope you understand about this behavioral patterns, diagnostic procedure and treatment methods for this cluster B personality disorder.